Welcome to the session on the core disciplines in public health. Now that we're almost at the end of the first introductory module, Learning in Public Health, let's take a break and reflect on what we have done so far. In this first module, we have referred to both the field of public health, the disciplines in public health, and the tools of public health. Other people might use these terms differently, but what is important is not the terminology, but the notion that public health is complex and depends on expertise from other disciplines. But at the center is the primary purpose of preventing disease and promoting the health of populations. Epidemiology is one of our main tools and is the basic science of public health. The population approach of epidemiology is fundamental to the whole discipline of public health. In this module, you have learnt about the history of epidemiology, the basic assumptions of epidemiology, and its contribution to public health, among other things. In the upcoming modules, Epidemiology and Biostatistics 1 and 2, you will learn much more, such as how to determine which risk factors are responsible for a condition. Once the risk factors and their consequences have been determined, the question of policy development becomes easier, since policies directed at specific risk factors can then be formulated. Biostatistics is our tool to formulate theories or hypotheses so that we can understand observed phenomena and proceed to test them based on carefully collected data. When repeated, this process helps the public health professional understand the world better. The collection, organization, storage, and display of vital statistics is a key public health activity, and in this module, you had the opportunity to learn about the different types of data and to see how we move from large amount of numbers through organizing and cleaning the data, analyzing data, and then finally publishing the results so that others can understand. You will get into more details in the modules Epidemiology and Biostatistics 1 and 2, and will get an opportunity to work with the software yourself. Calhoun describes health policy and management as a multidisciplinary field of inquiry and practice concerned with the delivery, quality, and costs of healthcare for individuals and populations. This definition assumes both a managerial and a policy concern with the structure, process, and outcomes of health services, including the costs, financing, organization, outcomes, and accessibility of care. In this module, we spent some time looking at the organization of care in terms of health systems as well as the policy-making process. You will learn about all the other aspects in your upcoming module, Principles of Health Policy and Management. In the week that we discussed disease prevention and control, you learned about the disease triad, as well as some interventions that can address the interactions between the three elements of the triad. You also had an opportunity to use one of the major tools in disease control, that of outbreak investigation and control. In the upcoming module on disease prevention and control, you will learn much more about the toolkit approach and all the tools that we have at our disposal. Environmental health is a microcosm of public health with an emphasis on prevention. It draws upon all the professions and professional disciplines that contribute to public health. Understanding the relationship between environment and health is fundamental to advancing public health. And as a core discipline of public health, environmental health is concerned with the delineation of environmental factors and their relationship to human health. In this first module, you learned about some key concepts and terms used in environmental health. In your upcoming module, the Introduction to Environmental Health, you will learn much more about environmental factors that we only touched on so far, such as air, food, water, etc. You will also explore environmental risks and their effect on human health. Social determinants of health and health promotion are key to prevent both communicable and non-communicable diseases. Health-related behavior is therefore an important concern. When microbial diseases constituted a major public health problem, personal hygiene played a well-recognized role in overcoming health threats. Now public health professionals are also required to consider social aspects of our lives and the link with health. While some of people's health is affected by social determinants such as sex, their behavior with respect to tobacco, drugs, food, exercise, and so on determine in large part the diseases that will affect them. In this module, we introduce the concept of health, the social determinants of health, and a key strategy that public health professionals use, that of health promotion. In the upcoming module on social determinants of health, you will have an opportunity to engage with the material in much more depth. Let's talk about you. Where do you fit in at the moment? Where do you want to fit in the future? What is it that you think you need to learn or do to fulfill your aspirations of becoming a public health professional? We look forward to walking at least part of the journey with you in this program. You will have an opportunity to think about these questions when you develop your personal development plan for becoming a public health professional. Thank you for listening to this session.